Imagine a situation where you are seeking medical care, hoping for understanding and solutions, but instead you feel a growing unease. Perhaps the atmosphere shifts, or you feel unheard, or even worse, disrespected. It can be incredibly unsettling when the very place meant to heal you starts to feel like a source of discomfort or anxiety. Recognizing these moments, and knowing how to respond, is key to protecting your health and peace of mind. You should consider leaving a doctor's office immediately if you experience direct threats to your safety, explicit discrimination, or a complete breakdown in professional and respectful communication that makes effective care impossible. Your right to feel safe and respected during medical treatment is non-negotiable, and when that trust is severely compromised, it is time to seek care elsewhere. This decision prioritizes your well-being above all else. The core reason for this firm stance lies in the fundamental principles of quality health care. Effective medical care is not just about diagnoses and treatments. It is also deeply rooted in a foundation of trust, respect, and open communication between a patient and their provider. When this foundation is missing, or was never present, the quality of care you receive is significantly jeopardized. You deserve an affirming environment, especially as an LGBTQ+ individual, where your identity is respected and your health needs are met without bias. Continuing care in a hostile or unsupportive setting can actually be detrimental to your physical and mental health. So what are the concrete situations and steps to take? Firstly, if a healthcare provider makes overtly discriminatory remarks based on your identity, like your sexual orientation or gender identity, or misgenders you repeatedly after correction, that is a clear red flag. If you feel physically threatened, or if a provider is verbally abusive, leave without hesitation. You do not need to explain yourself beyond a simple, "I am leaving." If your provider refuses to provide necessary medical care without a valid clinical reason, or dismisses your concerns entirely, especially about a known condition or widely accepted treatment, you have grounds to seek care elsewhere. For example, if you are denied hormone therapy despite meeting established medical guidelines, this is a serious concern. It is important to try and remain calm, gather your belongings, and exit the office. Afterwards, document everything you remember about the encounter, including dates, times, names, and specific incidents. This record can be vital if you choose to file a formal complaint or seek legal advice. This process is not about being difficult. It is about patient advocacy. Understanding your patient Bill of Rights, which typically includes the right to respectful care, informed consent, and non-discrimination, empowers you. Recognizing when a situation crosses the line from a minor disagreement to a harmful environment is a critical skill. Sometimes, leaving is the strongest form of self-care and advocacy you can practice. It shows you are committed to finding an affirming care team that genuinely supports your health journey. Many healthcare systems and advocacy groups are dedicated to helping patients find inclusive providers. Knowing about organizations that offer resources for finding LGBTQ+ friendly doctors is a powerful tool in your healthcare toolkit. Ultimately, your health journey is personal, and you are its primary steward. When faced with a situation that undermines your safety, respect, or ability to receive effective care, remember that leaving is a valid and often necessary step. It is not a failure, but an act of self-preservation and a commitment to securing the compassionate, competent, and affirming health care you undeniably deserve. By taking decisive action, you ensure your path to wellness is supported by providers who honor your whole self.
If this helps you feel seen, like, subscribe, and stay healthy with us.